Since the pandemic started in February of this year, 2020, the Emergency Operations Center was created as a response to the pandemic and an attempt to control the infection rates. There was also a food access task force created, and that task force has been led by my office in collaboration with the Austin Public Health Department and Economic Development and Parks and Rec. We've been working for the last 6 months to help ensure that the most vulnerable community members in Austin have access to adequate, nutritious food. And it has been an incredible journey in terms of trying to understand how to transition from a traditional model of emergency feeding where the term congregate feeding is applied, where you bring people together to one location traditionally. Unfortunately, during the COVID-19 pandemic, it was recognized immediately that this would be a potentially problematic method for providing emergency feeding. Bringing large numbers of people together could potentially increase infection rates. And so we spent the first 2 months of the pandemic response in early March and April developing different methodologies to support emergency feeding organizations to transition from congregate feeding to either curbside pickup meals or home delivery options. And these have gone fairly well over the last 6 months. And then we spent the next period, so what I call phase 2, working on identifying where the gaps where were community members not getting the resources that they needed. And so we spent really the month of April crafting solutions to figuring out how to address those gaps. For instance, we had a fantastic response from our restaurant community. So we worked really closely with 2 different restaurant clusters, basically groups of restaurants that came together and decided that they wanted to be part of the response and get these restaurants preparing meals to be distributed to places like schools and emergency feeding shelters. We'd never done anything quite like that before. The restaurants had never done anything quite like that before either, pivoting from traditional dine-in models to having restaurants preparing meals and distributing those meals and working in collaboration with each other. It was really impressive. One particular project called Good Works Austin, they figured out how to coordinate which restaurant is going to prepare what part of the meals and how to get all that stuff aggregated together and distributed out to various places around the community. I mean, so really an incredible logistics project. From my perspective as a food policy manager, even more exciting is, in addition to all those wins, we're also supporting our local farming community. Good Works Austin is committed to purchasing as much locally produced fruits and vegetables and protein products as possible from local farmers. Really excited and impressed with that effort, and we're documenting it, and we'll hopefully be able to have that as a tried and true strategy for future natural disasters and potential future pandemics. One really important thing that COVID has also illuminated is the food system, what we call the supply chain of our food system, is a really complicated beast, and sort of one track that supplies food for restaurants and public institutions, and then another track that supplies food to grocery stores. So very early on, not only were people concerned and scared and buying lots of groceries at the grocery store, the demand was great, and then the supply got narrowed. So we saw tremendous amounts of food waste. At the same time, we were seeing really significant shortages over here in the food retail world. So we've got a lot of work to do, I think, nationally to really rethink the way that system works, recognizing that unfortunately the COVID-19 pandemic is not going to be the last time that we see a really substantial pandemic, probably in our lifetime. I guess the good news, to end on a good note, is that these kind of things illuminate some of those weaknesses, and we can rethink the way that we've prioritized certain models. And I think recognizing the need to have a more localized food system is maybe the single biggest takeaway for this COVID-19 pandemic from my perspective. We need to have a robust local farming community that has really good multiple connected points to public institutions and food retail. We need to have lots of local distribution companies to get those products out of the fields into food retail and other locations. And we need to have lots of community members engaged around growing their own food and being as resilient as possible.